Good morning, everybody. This is Dr. Laura and
Hi.
Amanda, live from the Avalon Laser Clinic once again.
Mm-hmm. It's Thursday. We missed last week.
We missed, yeah.
But we're back.
We're back. You can't get rid of us that easily. So today we're going to be talking to Dr. Laura about what is a naturopath anyway, right?
Exactly.
Because if you're like me, you think you might know what the answer is, but you maybe don't know the full answer. At least that's how I think.
Yep.
Maybe I'm average. I'm not sure.
You're extraordinary.
Extraordinary,
She's
yes.
extraordinary.
Yeah. So, what is a naturopathic doctor?
Well, great question.
Thanks.
A naturopathic doctor is somebody who can help you address and treat your health concerns, but focuses more on helping you treat it using natural medicines and from a natural approach. We are trained very similar to medical doctors. Our training is a 4-year post-secondary program, so you need an undergraduate degree and then you go and do your training in naturopathic medicine. It includes a clinical internship year, which is similar to a residency. We can make assessment and diagnosis in the same way that medical doctors do, but we also synthesize information from different areas in terms of treating the whole person. So we're not just treating gastroenterology or just treating neurology or fertility, for example. We can pull from all the different aspects and organ systems of the person that you are in order to arrive at a diagnosis. As well, some of our diagnoses are not the typical ones that you would see in conventional medicine, because we also understand and practice traditional Chinese medicine. So some of the diagnoses might be liver yang rising or spleen qi deficiency, which sound very different from the ones you might be used to.
And what does that mean in English?
What? Who has that?
No, what does spleen qi deficiency?
Right. So traditional Chinese medicine looks at the body very differently than Western medicine does. They look at it as a composition of energies of different solidity. So you get things like the bones, which are very solid and firm forms of energy, to something much more fluid and gentler like the breath, which you can't physically see or touch, but sometimes you can when you're breathing in cold air, for example, to even finer, to something that's called qi, which is like the energy, or the prana. Yoga practitioners will often call it prana, that's circulating through the body, etc. So their diagnoses, while they sound strange, are actually about how the patterns of those energies interrelate to each other.
Cool. So how is coming to you different versus a medical doctor? So would I go to a medical doctor and you, or just you? So what's the difference mainly?
So I frequently co-manage care with my patients' medical doctors. We send professional letters back and forth with things that are going on. I'm keeping them on top of, any vitamins, minerals, botanicals, etc. that are going on, that sort of thing. You would generally come to see me because our treatments are different. Where the medical doctors focus on drugs and surgery and conventional therapies, we look at the different natural therapies. And I tell my patients about 80% of the work that I do is dietary and lifestyle based, because that helps you set the foundation for healthy living in your whole life. From there, then vitamins, minerals, botanicals, acupuncture, Asian medicine. There's a laundry list of therapies that I can pull from.
Cool. So how is a naturopathic doctor different than, especially here in St. John's, we have a lot of people with a naturotherapist designation.
Yeah.
So how is that different?
Yeah.
Because I know for a lot of us, the insurance is labeled under the same thing.
Right.
Which it isn't necessarily, correct?
That's right. Yeah, the under your insurance, all of the different practitioners generally qualify as long as they have some kind of training. We all kind of, the way I understand and explain it is, we all practice in the same realm, but the difference between a naturopath or a natural therapist versus a naturopathic doctor is that the naturotherapist will focus on one or maybe two particular therapies within the whole sphere of naturopathic medicine. As a naturopathic doctor, I've trained in all of them, basically. Yeah, well, maybe not all because we have our set training for the particular things, and then we branch out beyond there even more, but at least the baseline training is similar to that of a doctor.
Cool. All right. So why would someone seek you out versus a medical doctor?
Mostly because the therapies are different.
Other than you're gorgeous, right? And you're funny.
Yeah. Yeah, well, you would come and see me because you want to add the principles of healthy living and preventative medicine to your care. Naturopathic medicine is particularly great, actually, at treating chronic diseases. So things that are not necessarily acute, like, say, an infection or a broken arm or those kind of things. Even I would say certainly go see your medical doctor, go to the emergency room, that kind of thing. But for chronic diseases that have been in place for some time, that have components from multiple areas of your health, be it multiple organ systems, so again, neurology, gastro, or skin, things connect all over the place. We can help make those connections first, and then also help set you with the foundational principles of healthy living and preventative medicine to get your body to heal kind of from the inside out without just targeting symptoms.
Cool. So your services are covered under insurance for the most part?
Yeah.
If I'm booking a session...
No, they are. It's not the most part. They are covered.
Any insurance company that has it covered as a naturopathic clause, okay.
Yeah. I tell people to double check their policies because not every policy is a comprehensive policy, and they may or may not have naturopathic coverage at all. So check your details.
Okay.
Yeah.
And if they book an appointment with you, is it like going to a regular doctor's office and I have to wait for an hour or half an hour to get to see you?
No, I run on time. I pride myself, actually, on running on time. It was a hard-won skill.
And if I come to see you, how often do I typically have to come, and how long is an appointment?
Yeah. So the first visit is about 90 minutes, so it's an hour and a half. We spend a lot of time talking, and I get to know you, your health conditions, what happened in your childhood, and even what your poop looks like better than anybody else in St. John's.
And are you peeing clear?
Yes, right? Yes, if you haven't seen the dehydration video, go back and watch it. It's people are loving it. Right, so the first visit is a big intake interview. We'll get to know each other. I'll take a case history. I'll give you some initial instructions. I'll give you some homework as well. You'll have about a week's time to do that homework and get those instructions under control. We'll see how you do with that. On the second visit, we follow up and go through that homework. I will do a physical exam, so it's a good chance to get a top to bottom. I'll check lumps, bumps, moles, that sort of thing. I'll take your blood pressure, check your heart rate, etc., listen to things, that sort of stuff. I do it for all my new patients who enroll, just to make sure we get a good baseline health and we're not missing anything important. For women, it does include a breast exam, but I don't do any internal paps or gynaes or rectal exams, anything like that here. One of the things about naturopathic medicine in Newfoundland is we are unregulated. There's no regulatory body. So if I was going to run any internal testing or blood testing, for example, there's no legislation to protect you public health-wise, nor me as a practitioner or a regulatory body. So I just choose not to and refer you back to your medical doctor for that kind of testing.
And you can get those test results if you need them from the medical doctor anyway.
Yeah, absolutely. We just fill out a release of records and then they can fax them over and we can go through the results together. One of the other things that I help my patients with is I will translate and go through their blood work with them line by line so that they understand what was being tested and what the results say. And then second visit, after your physical exam and we've got all of our testing and information done, then we do the bulk of the treatment plan.
Okay, so how often would I have to come see you after those initial 2 sessions?
Oh, well, that depends on what's wrong. Actually,
okay, then I'm booked in for the year. No.
I'm being saucy. No, usually I let my patients go for 6 to 8 weeks, which is any initial therapies gives them a good 2 months to get things put in place, make some changes. Dietary changes, lifestyle changes take time, and so do natural medicines. They often, even in the research, 6 to 8 weeks is generally the follow-up time to get a sense of how well are you doing with that particular supplement? Is it working, right? So I'll follow up then, and then after the 2 months, it kind of depends on what's going on.
And it's a really good therapy for people who are willing to stick to a treatment plan.
Yes, absolutely. But I do say to my patients, I certainly expect progress on the recommendations that we put together and the strategies we set up, but it doesn't have to be perfect. You don't have to have it in place by Monday.
Not perfect is good for me.
Progress, not perfection.
Yeah.
Good enough. I read this quote yesterday. Good enough beats perfection every time. You just have to have enough progress to make it good enough.
Excellent.
Yeah.
Well, thank you, Dr. Laura. And if you have any questions, please post down below, and we'll be keeping an eye out for comments and questions, and Dr. Laura will be answering. And we look forward to seeing you again next week.
Next Thursday.
Next Thursday. Okay.
Thursday.
Thanks for watching, and we'll see you next week. And please share. If this was helpful, please share with your friends. Okay. Bye.
See ya.